I'm very sure that you must have kick-started you by the uh, first lecture of Dr. Nilanjan Day, as he's a renowned researcher of India, and must have given you the uh, brief insight about the theme of this program. Okay, so with that input, with that motivation, let's go ahead with this in this program ahead with my lecture, that is on the lymph nodes detection and classification in city images using deep learning, right? Somewhere what I feel that the researchers, those who want to pursue in this area, they need to work, they need to first find out the problem. Means they need to work towards finding out some particular problem, and once they find the problem, then they can think about using or developing the assistive technology, right? So this is what exactly we have done here, that we tried to find out, we had a discussion with some very good radiologists, and they have suggested that yes, we find some problems doing this particular scanning of the lymph nodes, where it is a general practice, it is very it's a general practice to find the cancer first at the lymph nodes. So if somebody is having a cancer, it is first detected at the lymph nodes. So that is why we got motivated, and I pick up this area of research of detecting the lymph nodes. So the important task is that we first find out the lymph nodes in the images. So I had asked the radiologist that how do you find it out? So they said that, sir, we have to keenly see everything. Even sometime those the radiologists, those who are not experienced, they even have to see the Hornsfield units, and on the basis of that, then they localize the lymph nodes, and thereafter we do the analysis of that lymph node. And if the expert confirms that that lymph node is having some abnormality, then even after that, finding the abnormality in the CT images, they used to prefer to ask that patient to go for biopsy. Okay, so biopsy, in the sense, they take out the cells from that particular lymph node and they do the biological uh, testing. So it is some sort of invasive method, right? And that is why it's really difficult in such scenarios where uh, there is a non-invasive methodology is involved, and even after involvement of the non-invasive methodology, paying so much money for giving for getting the CT scan, and if it is detected, yeah, if radiologists find it suspicious, then they again ask it for the biopsy. So ultimately, the biopsy is somewhere is the final solution to such kind of events, right? So with that motivation, what we thought, why not to make some automated system only based on the city images, and we are still trying it, so that if we are able to succeed in this particular task, then there would not be either there will be confirm indication of the abnormality, or and with that, maybe we can save someone's money going for biopsy as well. Okay, so let me start with this my presentation today regarding healthcare. As you all know that in the today's time, healthcare is having the highest priority. Means as you know, everyone is now facing the issues. We already are going through the pandemic time, and that is why the healthcare is it is the so important sector, where actually everybody is everybody faces problem related to the facility, related to getting the proper medication, related to even that treatment, the outcome of that treatment, analyzing that outcome of treatment. All these things are very important. Okay, and due to that, one of that method, one of the methods in healthcare, which is very important, that is medical imaging. Okay, now, what this medical imaging that we use to have first thing is that to diagnose the abnormality. At the same time, we also use it for understanding the effect of the treatment as well. Okay, and if you will see, the medical imaging modalities they are different. Medical imaging modalities are available. They are invasive, non-invasive. Invasive in the sense, you there will be cut in your body, and inside the body you are going to image something. So that sort of invasive method. Or there are some imaging modalities, those are even harmful to your body. Say that the X-ray radiation exposure to your body is harmful, right? So there are even different processes are involved, that you have to get the preparation for doing that scan. Like if you are going for the ultrasound, you have to take the water, or you have to fill up your stomach with the water. Okay, so these things are involved in the different medical imaging, and there are different algorithms, softwares, those who are given by the companies, those who prepare those equipments, okay, to make, to visualize those images, to measure the abnormal sections or abnormal organs, and so that the radiologist can interpret something. So whatever those interpretations are there, that require a very expert knowledge in that domain, right? Doing an image interpretation is not very easy. It's not that easy. Unless until you have an expertise in and interpreting such images, it is really get difficult. So it is while doing that interpretation, those interpretation may, as a with that expertise it is okay, but it is, even if it is not, if that expert is not available, then in that cases it is limited due to selection preferences of the medical expert. Then it may happen that if I'm going to select someone with less expertise, the results may be different. Okay, subjectivity, complexity involved in the medical imaging. Okay, there is also extensive variation exists between different acquisition protocols, right? That also makes those interpretations difficult. And then there are artifacts are there. There are noises, there are artifacts in the images, which makes the interpretations of those images difficult. Even there is a problem of inter and intra observer variability. Means there can be, the two radiologists can have a different opinion. Even a single radiologist on a different two occasions can have a different opinion. And then there is also a problem of fatigue, because uh, if you people are seeing any one patient, and if you are doing some CT scan or some PET scan, or your, say, even uh, uh, ultrasound scanning, say that intravascular ultrasound is there, 2500 images they create in one scan. Okay, or even more than that. Okay, so getting analyzing such huge number of images for one patient, okay, seeing every slice, every image, and understanding the having an interpretation from those images, it is a tedious task, and that creates the fatigue. Okay, so due to all that limitations, first thing is that yes, in the healthcare, medical imaging is very important, and that is the most widely used solution for deciding on the for the diagnosis and the treatment. But in the problem is that the interpretations done in those medical images are actually having some limitations, right? And that is why it is really important in the domain of medical imaging, that we should develop some cardiac system, means computer diagnosis system, where the computer will be able to diagnose directly from the images, without having any interference from the radiologist. Maybe some there, if you will see the present scenario, it is somewhat manual, means the doctors, radiologists analyze the images. Okay, and if there are some computer assistance is there, so that assistance is related to just by to make that radiologist able to see in details, making the 3D images, or giving some 3D structures, giving an area in centimeters and other thing. That facility is there with the softwares and the programs that has been embedded in those machines. Okay, but still there are and even if you will see, there is also some diagnosis, auto diagnosis methods, but those are some semi automated, right? So with that, but what is the purpose in the CADEX system, that we like to give them totally automated systems where the expertise will be that whatever the expertise is required, that will be created as an artificial intelligence in those computer machines, and on the basis of that artificial intelligence, the computer will be able to diagnose the abnormality from the medical images. So with that motive, we have started this work. Okay, and these are the some of the imaging modalities that you all know, that is X-ray, ultrasound, CT, PET scan, MRI. Okay, now what is the difficulty here? First thing is that because of the variety of this medical imaging modalities, one thing is very clear, that we cannot design any one single solution for all the medical imaging modalities. First thing, right? Second thing is that a variety of the organs, so that kidney is there, then liver is there, then heart is there. So different organs are there. Different organs are having the different diseases. Okay, even I cannot say that this heart will be having only one disease. Okay, there can be various diseases in the heart. So looking into this variety of the medical imaging modalities and the variety of the organs and the related diseases. Okay, so this increases our challenge while designing these CADEX systems. We have to see that we have to start it from the first point, that we should climb the things step by step. So try to find out or try to design for one disease. Okay, for one particular organs, one disease. Okay, once you are done with the one organ, the diseases of all the organs, then go to the another organs and develop it for the all the diseases for the second organ. Likewise, you create once you create you we can create one computer diagnosis system for the one imaging modality. Okay, one particular organ. Okay, so likewise you can go and develop such systems. And once we have that sort of research, complete research, then it can be only embedded into the machines. So that is why, if you will see in the literature, there is huge work is going on this direction. And why it is still appealing, why it is still challenging, because we have different variety of medical imaging modalities, we have various organs, we have the various diseases of those organs, and due to that, it is still going on, right? Now, when we design any diagnosis system, it is actually involved with the two basic steps. First one is that we have to first find out we have to first find out the location. Okay, or we have to first find out the abnormal part of your body. That is what is called as, if you see, if you if I talk it that in terms of medical in terms of image processing, I call it as a segmentation, right? So what I will do, I will, in one image, you can see here, I have this green circle here mounted on this city images. This is the abdominal city image, and what I have done here, I have detected this lymph node. This is called as segmentation. Okay, so detection of the abnormal part in the images, medical images, that is called as medical image segmentation, right? So medical imaging segmentation and classification, these are the two important parts. And medical image segmentation refers to partitioning of those target organ from the full images. Okay, from the full image. So you can see here, this lymph node has been detected here, and this is its mask. Okay, you can see this is the mask of that detected lymph node, which is which indicates that this is here you can see, or you can measure the size of that lymph node, or you can extract out this lymph node from these images. You can check out its intensity of the gray levels and find out the severity, decide something on the severity. If we do that, I will say it is a task of classification. We'll come to that one, but let me give another example here. This is another lung city image here that you can see, which is having the lungs in these city images, and these lungs has been segmented here. So you can see this lungs has been separated out. This is called as segmentation, medical image segmentation. So there are methods which are able, see, this is also one of the challenge where we have to actually try to segment the lungs from the city images. Once we have segmented this lung parenchymas In that lung parenchymas also I have done the segmentation of these nodules. You can see these are the segmented nodules that is circled in the with the red circles. This is an enlarged image here. You can see these are the lung nodules. So in that segmented lung parenchyma, we have further did the segmentation of the lung nodules. So this is the segmentation, right? You have to find out the abnormal objects in your images. Okay. So for finding out that abnormal images, first you may require to find out to first segment the part of your organ, and in that organ, then you have to find out the abnormality. So it is a part of the process, right? So you have to understand the problem, and accordingly you have to do the segmentation of your medical images, right? So this is again an example, as I told you about the lymph nodes. This is the abdominal scan where it is the lymph node is segmented. This is a mediastinal lymph node segmentation. You can see this is mediastinal lymph nodes that we have detected by using the computer-aided diagnosis system, computer-aided detection system. When I say a segmentation, the part is only up to detection. Once, if I'm doing the classification part on that segmented images, then classification. So classification, why I will use the classification? I will try to find out whether that lymph nodes or whether that lung nodules are cancerous or not, malignant or benign. So if I just find out that thing from that classification, then I will say that it is a diagnosis, right? So that is a diagnosis. So complete system will be a diagnosis system. If I just stop it to my detection system, it will be computer-aided detection. But if I do segmentation as well as classification or diagnosis, then it will be a total system of computer-aided diagnosis system, right? So this is again one example, this is all work. This is all the research work that we have done, that is done by my team, right? So this is also one example. Here you can see this is an ultrasound images, intravascular ultrasound images, and in this intravascular ultrasound images, we have just find out this calcium deposited on the on your artery walls. Okay, you can see these are this white portion is nothing but the calcium which actually deposited on the artery wall. So what happened whenever the vessels, your blood vessels or blood arteries have this deposited calcium, if it increases, then it blocks the blood flow, and due to that you starts to get the either stroke or heart attack. All that things happen, and due to which the sudden death occurs of a human being. So this is when this was also our very challenging research where we tried to find out this calcium. We successfully find it out, and we also measured the volume of that calcium. And if this sort of assistive technology is there, and if somebody is being carried out the intravascular ultrasound for some patient, then we can suggest to the medical practitioners, that yes, whether you should go for the stenting or whether you go for the bypass, we can suggest on the basis of this the outcomes of our research, right? So that is one thing. And then yes, as I told you, that second part in your computer-aided diagnosis system is the classification. So in the classification, we are basically to find out whether those target and the non-target class, like deceased and non-deceased. So that is what we are going to find out in the classification, right? Yes, uh, this is what exactly is the disease and non-disease. So this is what exactly I wanted to tell you. So you can see these are the some images that we have taken here. These are the lymph node images. So after doing the segmentation will be of one area. It will be a segmented area. So it will be circular, semicircular, it will be some odd boundary. So obviously that part is will it in images in your computer system, it cannot be a random shape. It can be only a some matrix shape. Okay, so it can be a rectangular, it can be a square. So what we have done, when we segmented those images corresponding to that segmented part, we just take out the square and the rectangular parts for that segmented lymph nodes. Okay, and these are nothing but the lymph nodes, those who are been given to the classification processes, and from that we find out that the lymph nodes in this row A are malignant, while the lymph nodes in this row B are the benign, right? So this is how we, from those segmented images, from those segmented abnormalities, when we give it to the classification gives us an idea whether those segmented regions of your body are diseased or non-diseased. So that is what exactly is the purpose here of the classification, right? So yes. Now, what are the challenges in medical images segmentation and classification? When we do that segmentation and classification, there are numerous challenges. Okay, and few of them I have tabulated here, and which are very important. That first and very foremost thing is that we require an expert anatomical knowledge. Means lymph node, where the lymph node gets is normally located, okay, where we find the lymph nodes, where we have to search the lymph nodes in the city images. Everything is very important, right? And that requires an expert knowledge. Then there is a yes, there is a problem of inter and intra observer variability. As I told you that two radiologists can have a different opinion, and the same radiologist on second two another two separate occasions may have some different opinion. And second thing is that yes, whatever the medical imaging is involved, it is expensive. And if we do some manual segmentation, so that manual segmentation is time consuming, it creates the fatigue, and it also the performance is affected by different acquisition protocols and different artifacts. And there is a large within class appearance, location, pose variations. Because see, every abnormality, say that if you find some lung cancer in one patient at one particular position, you will not find the same at the same location lung cancer in another patient, right? So that everything changes in this scenario, right? And due to that, it becomes difficult. It becomes difficult for developing such an assistive technology for the radiologist, right? So if we understood these manual limitations, and if we act accordingly and starts addressing problem one by one problem, then we'll be able to have the then we are able to develop such technology. So if we develop these technologies, what will be the advantages? It will be used in useful in proper and detailed diagnosis. It will help to provide diagnosis results in less time. It will be cheap, right? Let me tell you how it will be cheap. See, in India, or just in India, I'm telling you that the doctors and patient ratio is almost 1 is to 2000. Means behind 2000 patients there is one doctor. Now you just understand how difficult it is for them to to give time to the patients. So if we can save, that is why the human resources in the medical field are very costly. And if we develop some computer based systems, they will be cheaper compared to the human cost of the human resources involved in the medical field. So that is the another advantage. Require It will be requiring less or no anatomy, I will not say no anatomical structure expert knowledge, because it will see whatever the computer program or computer algorithm that you will develop, it will be an artificial intelligence based. So intelligence will be developed, or it may be continuously updating its intelligence, right? So that will also be there. But yes, when it will be a one time process, that you will be embedding the expert knowledge into your artificial intelligence algorithm, or it will be a simply an updatation process. But it will not be involved every time the presence of that expert like an expert radiologist for every scan, right? So that may not be needed. Then there will be a therapy selection and planning can be done very easily. It will be helps to conduct in computer aided surgeries also. That if something is, as you all know that even the surgeries now are having the robotics involved into that. Doctors just look on the screen, they just instruct the things to the robots, and the robots perform their surgeries. So if the scan is there, that if you perform some scan and do some automatic diagnosis, that can be given as an input to that automated surgery processing, right? So even it can be also used to assess the therapy responses. It can be used for designing the drugs. It can be used for uh, uh, as an important part of the different CAD systems, like so this is what exactly is the advantages of the computer diagnosis, medical image segmentation or classification, what I'm telling you. Okay, so let's now go to the deep learning, because as I told you about my topic about deep learning. Okay, so I have given you the generalized introduction regarding the CADEX systems where the segmentation and classification is involved. We also have seen how those in our different research studies, how we have done those segmentation, different ultrasound images, then CT images, and then uh, intravascular ultrasound images, CT images, lymph nodes, then lung nodules, lung segmentation, all that has been diagnosed, right? So this we all conducted this, whatever this research that we are doing, that we were doing it earlier by using the because see, when I say artificial intelligence, whenever you want to develop any artificial intelligence in the computer systems, what do you need? First thing is that you need the expert's knowledge, right? Second thing is that your machine should learn that expert knowledge, right? And that is what we call as a learning. Okay, machine learning. So learning of that machine is really important, and that is the most crucial part of the artificial intelligence, because unless until that learning is good from the data, okay, then only it will be able to perform the intelligent task. Okay, and that is why this learning process is being explored so widely and by so thoroughly by the researchers, right? And earlier it was having some machine learning, we used to call as machine learning. Now we call it as a deep learning. So machine learning was a generalized name earlier, that yes, you are going to learn, you are going to make your machine learn, right? But now the era has come where we are able to learn your we are able to make our learn machine, we are going to make our machine learn in a deeper sense. Okay, deeper sense, it means that it is able to it is able to learn the minute details. It was fine features can be learned from the data. So that is what exactly is the deep learning is all about, right? So this medical whatever this learning process here, it means it is involved medical image processing, computer diagnosis, image interpretation, image registration, image segmentation, image guided therapy. All these things are involved with this machine learning and deep learning, right? These techniques learn multiple levels of abstraction, representation, and information. That is what I am telling you. That multiple levels. I will say it will go in a hierarchical way. It will first learn the low level features, then medium level features, then high level features. So that is how your learning will become deeper and deeper. Okay. And most important thing is that about the deep learning is that it is totally feature independent. Means you need not to manually do any feature extraction. It will do it automatically from your raw data. So as a research scientist, I just have to focus on designing the deep learning architecture. And once I'm done with that, I just have to give my raw input data, right? So that is what exactly is there. So this is the difference between the machine learning and deep learning. See, these are the diseased images. From these images, you are going to manually extract the features. Those features may be very high, then you will be doing the feature selection also. And after doing that feature extraction and selection, then it will go to the classifier, and with that from that classifier the machine will learn that what exactly this data is having. Okay, and it will be able to then diagnose. While in case of deep learning, you just have to give the images, it will do the self feature extraction and calculation, and after that it will be do the task of classification or segmentation and will give you the result. So that is what exactly the difference between the machine learning. The major difference is feature engineering, right? And I also will tell you that It's not only feature engineering, but you also have to, you will also see a difference of understand learning. The level of features that deep learning is able to learn is very high. Okay, so that is the difference. So the very first basic deep learning architecture that was that has started for the images only, that has started from for the images, that was the convolutional neural network. So that, as I told you, that it will be this deep learning architectures are having the hierarchical feature learning. You can see here that it will be extracting the features in a sequential manner, low level, then medium level, then high level. Then who will do that feature extraction? This is the convolution process will be doing the task of the feature extraction. You can see here in this diagram, this is the input image of our lymph node, and that has been given to the convolution filters. So these filters are getting convoluted with these images, and whatever the feature map that will come as an output to this convolutional layer, that will be the feature map, that will be the my features, and those features will go to the your activation function, and this activation function will be finally giving the result of that convolution, right? And there is another, these are the layers, pooling, and then there is a dropout, then there is a fully connected layer. So there are different layers in this. If you are able to recall, in the when the people have started about thinking about the artificial intelligence, they had started with the neural network. In that time also, in the neural network, let me tell you one thing, the concept of deep learning was understood, but the thing was that, due to, first thing is that we were having that time a limited memory of the computers, because when I say that I do not want to involve the feature engineering, I want my machine to learn from my raw data, then in that case we have to give a large raw data to your machines, right? Second thing is that whatever the non-linearity in the data was involved is involved, even today is also, that non-linearity, handling that non-linearity was not possible with the with that time, in that time, that times methodologies. But in today's era, we have very good algorithms which are able to handle the non-linearities in the data. Third thing was that computational complexity, then computational processing power, that was all limited, and due to that it was not actually evolved, or it was not actually worked in the in the time of the neural networks. Even if you are able to recall, kuch log agar aap mein se, if there are some uh, old scientists are there present in this program, they will be able to tell you, in the neural network we used to use only one hidden layer, one or two hidden layers, not more than that. But it was clear at that time also to all the scientists, those who were using the neural networks, that if I'm increasing the number of hidden layers, my output should improvise. But it never used to get improvised. The reason was that हम लोग करते थे, we used to increase the hidden layers, but we never used to get the proper output. The reason was that, or whatever the output that we get for a single hidden layer, we were getting the similar output with the 2 or 3 or 4 hidden layers. The reason was that your that deep learning was not possible. Your hierarchical feature engineering, your computer machine was not having the programs to learn the detailed features from your data. Your computer programs were not able to have the abilities or the programs to handle those non-linear data, non-linearities in the data. The computers were not having a large input data. So, or due to all that limitations, we were restricted ourselves for developing that time the artificial intelligence with 1 or 2 hidden layers in the neural network, right? But now it is possible that we can increase, as we have increased our computational complexity, we are able to handle the non-linearities in the data. We have a large storage, detailed storage possible now, and we have a very good high computational machines are there, which can have a deep, they are not having a single processor nowadays, they have multiple processors running parallelly with one another, with each other. Okay, and due to that, it is very much possible today that we can have these deep learning architectures, and we can do the task of developing a very good artificial intelligence intelligent systems, right? So yes, so this is involves the convolution does here feature engineering, and there are some other layers also for computational and the overfitting reduction. So that is why this pooling, dropout, all these are here. Their main task is that to handle the problem of overfitting and the to improvise the computation. Now overfitting is something that where we are expecting that you have gone too much into the means size detection. Means what I mean to say that if I want to detect something, you're overfitting to it. Okay, you're fitting to that, but it is you're just going over to that one, right? It may not be required. Okay, for getting that overfitted results, we have to put a lot of efforts. We can avoid that overfitting, and if I can avoid that overfitting and just come to my close to my fitting area, then I will be either reducing my competition. I'll be reducing my competitions, as well as it will also be reducing my uh, uh, the that yes, trainable parameters, ultimately the competitions only, right? Then there is optimization is also involved here. That optimization is used to modifying the filter weights, because here is very important. When you will see here, if I am taking it as a task of the classification, obviously I'll be doing the supervised learning. So I'll be checking my output with the my desired outputs, and if that desired output is not corrected, so I will either calculate here the loss function values, or I will from that loss function values, I'll be optimizing the weights of my these convolution filters. So that optimization is very important again here as well. So I will just give an example here that what are these convolutional layer. You can see this is an input matrix. This is your input data. Just consider this is an input your data. This is your convolution matrix. Now this this convolution filter is getting convoluted with this matrix. This filter is getting convoluted with this matrix like this. You can see, right? And after the convolution, I'm getting here the output as 4 3 4 2 4 3. So you can see my this input matrix of size 5 cross 5 is actually getting convoluted with this my convolutional filter of size 3 by 3, and finally I'm getting the convoluted output. The output of my this convolution matrix is only 3 by 3. First thing is that my data site has been reduced, and these are having the more core features information. Okay, so that I am getting here. Then there is a max pooling layer. Max pooling layer is also involved here. Pooling is nothing but that we are going to reduce the size of our matrices, right? So this is exactly what we are doing. That see here in this data, that if I'm considering this part of the my matrix where it is 6 4 5 4, so in that I'm getting the maximum value. So instead of taking all the 4 values, I'll be just taking the maximum value here. See in this matrix I'm taking 8 as a maximum value. From this here I'm taking 7 as the maximum value, and here in 9. So this is how this max pooling layer will happen. Then there is an activation layer. Yes, activation function is involved, where you will be finding out that what is the after this convoluted features. So this feature map will go to your action potential. Okay, and the action your activation function, and your activation function will giving you the output on the basis of that feature. Okay, so this is a ReLU function, rectifier linear init. This is here, which is able to handle the non-linearity of the data. This function was not earlier there. Okay, so it is fast, it is less expensive, it is more expressive, and it is having the it prevents the gradient vanishing problem in the feature sets. Okay, so that is why it is very popular into the deep learning. Then there is a dropout layer is also there sometimes. That what is dropout? Dropout in the sense, there are, see, whenever whatever the neurons are there, when we say those neurons are here in every layer, some of the neurons are not active, they are not contributing to the results. Okay, either they are not contributing or they are contributing in a negative sense. So we can drop such neurons. Okay, and if we drop such neurons, then what will happen, that you will see that sometimes the performance of your network gets improvised. So that is one of the things. Yes, now let me come to my application, that is detection of the lymph nodes. So before going to in the lymph nodes, let me just give you the brief introduction about what is the lymphatic system. Lymphatic system is something that let me tell you about the lymphatic system. It is a system actually which plays a very important role, vital role in a cardiovascular immune system. Basically, what happens in human body, 20 liters of the blood is generated per day, right? And out of that, 17 liters of the blood that 20 liters of the blood goes to all the different organs of your body. And what happens in the return path, only 17 liters come as a roughly 17 liters of the filtered plasma are reobserved directly into the blood vessels, right? while the remaining 3 liters remain in the interstitial fluid. So now only 17 liters will come, impure blood will come, and with that, along with that, that remaining 3% interstitial fluid is nothing but called as the lymph fluid. That lymph fluid will return to the it has a separate system, it has a different system, it has a separate system to return to the different organs of the body, right? So the lymph is formed when the interstitial fluid is collected through the lymph capillaries. So there is a lymph capillaries. Lymph nodes are basically these are nothing but the checkpoints that monitors and cleans the lymph. So these are the checkpoints where lymph is actually filtered or it is purified, I must say that. Okay, so let me just show you through this diagram. You can see this is a heart where you can see this is your blood, 20 liters blood coming to your different biological tissues, and from that biological tissues this 17 liter of the blood returning to the heart, while this 3 liters of the lymph, okay, intestinal fluid, which is actually converted into the lymph, will go through this lymphatic system. This is my lymphatic system, which are having this round shaped structures that is called as lymph nodes. Okay, so they filter the tissue fluid, right? So this is the lymphatic system, this is how it works. And now you have to understand the importance of these lymph nodes here. They are very critical. ये जो आप लोग देखते हैं ना प्लाज्मा मिला है, या फिर आप लोग बोलते हैं कि right now in the COVID time, you people have given the plasma, you people have seen that yes, there is, we said that yes, you should not have any what I say, cough. So it has been said that whenever the viral attack is happening there, it is actually coming through these lymph nodes first. So lymph nodes will those lymph nodes, if they are get affected, what will happen? Every protein or plasma or that your filtered fluid will go west. It is not going, it is not giving the necessary nutrition to your body. And that is why if that filters are getting affected, if they are not able to work properly, your purification system of will be destroyed, right? And that is why the impurity will remain inside your body, and you will remain infected, you will remain diseased. Okay, and that is why this is very important. Now just let me show you where these lymph nodes are there. Likewise, what I have shown you in a generalized diagram, you just look at this. Almost 400 to 50 lymph nodes are there in your body, and you just see the location. It is on the legs, it is on the lower part of your body, then there is a mediastinal part, then there is an abdominal part, then there is a cervical part is also having this lymph nodes. So likewise, these are the small nodules, some small nodules are there, and they are all over your body. So you just understand that those that that fluid is flowing all through these lymph nodes, and all these lymph nodes are doing the purification process, right? And if those lymph nodes are diseased, if any part of your lymph body is, say that some particular part, some liver में आपके जैसे मान लीजिए infection हो गया है, yeah, so what will happen when that intestinal fluid will come from the liver, and when it will flow through the lymph node, that impurity will first interact with the lymph node close to that liver. And due to that, if you just properly if you monitor your lymph node close to the liver, you will first find out the symptoms of the liver infection at that lymph node. And after finding the abnormality in the lymph node, then you will go for a proper scanning of your liver कि exactly वहां पर क्या कहां पर है. And it many times happen that from that one cancer from the organ also goes to the cancer to the lymph nodes. तो आपके organ में अगर कोई cancer हुआ है, तो वो आपके lymph node में भी cancer हो सकता है. और ये भी होता है कि lymph node में जो cancer हुआ है वो जाके आपके organ में हो जाता है. So both these things are possible, right? So due to that, it is very important that we should, if there can be an automated system to diagnose these lymph nodes, it will be very good. And with that motive, we have done this task. So clinical significance, as I told you about, जो मैंने अभी आपको बताया, all that clinical significance is there. Most important thing is that it assesses the progress of the disease. आपको अगर प्रोग्रेस देखना है किसी भी डिसीज का, तो आपको देखना चाहिए कि लिम्फ नोड में क्या स्टेटस है. सो लिम्फ नोड, अगर लिम्फ नोड में अगर मेटास्टेसिस है, सो इट विल स्टार्ट टू गेट एनलार्ज, उसका साइज बढ़ते चला जाता है. एंड इफ दैट size is increasing day by day, then we can also predict that it is a cancerous thing, right? So this is what exactly is there. Then there is lymph node metastasis also gives information regarding the selection of the therapy, that what therapy we should use. Then surgical planning can be decided. All that can be done by using lymph node assessment. Now, what are the challenges? As I told you, lymph nodes are very minute, and it is really difficult for with your just by looking at those. अगर आप किसी नॉन एक्सपर्ट पर्सन को बोलेंगे कि आप जस्ट सिटी इमेज में लोकलाइज करिए कि लिम्फ नोड्स को, तो वो शायद लोकलाइज भी ना कर पाए. दे आर सो माइन्यूट एंड दे आर सो having a structure similar to some other things. They are having the similar gray levels compared to the background, so it is very difficult to find them. So that is why they suffers from the problem of inter and intra observer variability. They are also having the location और उनके pose variation, उनका appearance circular होता है, कभी semi circular होता है. So the shape is also not fixed. So all due to all that things, it is difficult. There are also some many artifacts, and one very important thing is that they also available in the form of the clusters. Clusters in the sense there will be more than one lymph nodes in a group. So due to that, what happens, because of these clusters, the boundary between the different nodes is very unclear. It either not clear, or sometimes it is not even visible. Okay, and due to that, there is a very high false positive rate is there. That, and there is a class imbalance problem is also happens in the cases of the lymph nodes. That class imbalance in the sense, you will be having the different as I told you, mediastinal and abdominal, and there will be different classes. So that will be a problem again. So you just have a look at this. You see here, this is the lymph node that is localized here. This is the cluster of the lymph nodes that you can see here in this image, right? You can see these yellow dots and this red one. Okay, so ये जो आपका lymph node है, इसके surrounding में you can see these are the another lymph nodes as well. So it is very difficult if you want to say that yes, this one I just specifically want to detect. So you'll be having a very possible rate that this also get missegmented or misdetected. Okay, so we have taken one image data set here for the lymph nodes, city image data set for this experimentation, that was having mediastinal lymph nodes of 90 patients and total 389 lymph nodes images that we have taken. And then for abdominal lymph nodes also, so 86 from the 86 patients, they are having the data set of 595 lymph nodes. And in our this experimentation, we have conducted the experimentation on this data of the mediastinal lymph node and the abdominal lymph nodes. And for that, we have used the deep learning models like UNIT, and we also have used the further we also have used the transfer learning. Okay, so how I did that thing, let me just tell you that thing. First, I would like to tell you that when you are doing the segmentation of the lymph nodes, there are some limitations. See, unless until you understand the problem challenges, you cannot improvise on your technology. Okay, आप अपने CADX system पे improvise नहीं कर सकते. That's why you, for every time, first you find out what are the limitations of the existing methodologies. Okay, so we have find out that yes, lymph nodes are having a very small size, and that is somewhere a big problem. Their shape and size of the lymph nodes is vary from one patient to patient, right? In the lymph node processes, in lymph node detection, there is a requirement of the pre-processing stages like ROI segmentation, and then from that ROI segmentation, in that ROI segmentation, then we are finding out or detecting the lymph nodes. That's how process are involved, which makes the things very cumbersome and very lengthy. There are some lot of feature selection or that may also require. Okay, calculations. Then there are a high number of false positive are possible, as I told you about the clusters, lymph node clusters are there. So it is very much possible that you get wrongly detecting some other lymph node. Okay, and a last thing is that these are the limitations which makes previous work that kept an area open for the more advanced research, and that's why we have went into the deep learning architectures uh, for the detection of the lymph node segmentation and classification. Right. So for the segmentation, if you will see, very popular deep learning architecture is the UNet. What a UNet is all about. When I say U in the sense, you just have to understand that it is a shape of the U. And if you just look at the shape of the U, if you just observe the shape of the U, it is having one downward path and one upward path, right? So here also this UNet architecture is having a one encoding path, and then there is a decoding path. One is a contracting path, one is expanding path, right? I call that thing as same thing. So that is what exactly is there. Encoding is there, as well as there is a decoding, or I can also say that alternatively as a contracting path and the contracting path and the expanding path, right? For capturing the context and the localization. So that is what is involved. Then there is a one thing that we have to understand. It is a fully convolution network. Fully convolution network in the sense that there will be convolution stages will be there, multiple convolution stages there. There will be only convolution will be happening throughout the network. There will be no other task involved, right? It will be majorly a feature extraction processes, right? Then there is a unit is having the it can be performed well with the few training samples. This is very much established algorithm on the for the image segmentation, right? Let me tell you that. And it is very much it gives good results with the even few training samples also, because as I was telling you from the beginning, deep learning architectures requires larger data set, because your deep learning architectures need to learn the minute details. So if you want to learn the minute details, you have to give the larger data set, right? So yes, there is a skip connection is there in the unit, which actually collects the information from the multiple encoding feature extractions. So there will be continuous multiple extraction process through the multiple convolutional layers, but there will be skip connections. Those skip connections will be taking that information from the contracting path to the expanding path, or from the your encoding part to the decoding path. I will show you that in the diagram as well. Okay, so this enhances the predicting capabilities of the unit architecture. Okay, and unit extracting similar low level features repeatedly, which leads to the excess network parameters, and it may also suffers from the problem of ओवरफिटिंग, नेटवर्क ओवरफिटिंग. तो ये भी हो सकता है कि बार बार वही चीजें अगर आप निकाल रहे हैं, वही फीचर्स आप लोग अगर लर्न कर रहे हैं, that is called a problem of overfitting. So it happens sometime because as it has involved multiple convolutional layers, तो वो आपके फीचर्स को फाइन ट्यून करते जाना चाहिए, मतलब लो लेवल फिर मीडियम लेवल, उनको फीचर्स के अंदर से फीचर और इंफॉर्मेशन एक्सट्रैक्ट करते आनी चाहिए. If it is not happening, then I will say that it is a overfitted data. Okay, so in that case your network will become overfitted. So that you have to you have to control, right? In this unit structure, there is one very advanced and very recently proposed network is the attention unit. Okay, attention unit actually overcomes this limitation of the unit of the overfitting problems. It accepts the alike low level features repeatedly. This accounts for excess network parameters and leads up to overfitting. This I already told you about the CNN also, and this also happens in the unit as well. So there will be creating a problem of the class imbalance. Okay, now in case of attention unit, it specifically focus on the target structures, that what you need to achieve. See, after every convolutional layer network, there in this attention unit there will be a loss function values, and those loss function values will be decided that yes, this much need to be attained at every convolutional layer output. So that will be done in the attention unit network. and it will be focusing on the target organs, it will be focusing on the target structure, and due to that it is having a, it is able to see, if you are making something to learn, some algorithm to learn to achieve some target, then that learning will be updating one. It will not be suffering from the problem of the overfitting. Okay, but the thing is that you have to have that target structure, and you should include that target structure in the form of a, in the form of a values, or like in the skip connection. Here I told you about the skip connection here in the attention unit. Let me just show you that thing. So regarding the attention unit, it is downgrades the gradients of the background and it activates the gradients of the foreground that is involved. See, this is much technical. You may not be able to understand, but the thing, you just have to understand few things. First thing is you encoding and decoding. Second thing, there is a one skip connection is there which actually collects the information, right? So in the skip connection which collects the information in the unit architecture, uh, this enhances the preceding capabilities of the unit architecture. So encoding में या decoding में जब भी आप one convolution से next convolution जाते हैं, तो वो वहां पे उस on the basis of that information your feature extraction improvises. Then in attention mechanism, linear transformation is there followed by the non-linear transformation. This makes the unit architecture to focused on the target, to attention. Okay, it increases the attention. So in this work we have used 1x1 convolution filter for the linear transformation, and sigmoid as a non-linear transformation, and this is the function of that what we have used. Okay, and now this is the structure of the unit. You just see U, this is the shape U, right? This is your input, then there is a convolutional layer, then there is a max pooling layer, convolutional layer, max pooling layer, convolutional layer. So there are multiple convolutional layers in this encoding path. Then there, here at this center layer is there. Okay, or there is a, once this you come at the center layer, then after that the decoding path will start. This is the upsampling. So here here I was doing the downsampling. This max pooling is nothing but the downsampling. But after the center this layer, I'll be doing the upsampling. So I will what I'm doing here, I have taken this size of 256 into 56 into cross 1. फिर उसके बाद मैंने कन्वोल्यूशन किया, तो आप देखिए यहाँ पे साइज इसका 32 हो गया है. फिर मैंने इसका मैक्स पुलिंग किया. मैक्स पुलिंग मींस कॉन्ट्रैक्टिंग पाथ. So I am now reducing the size. The size is now reduced to 128 into 128 into 32. 256 has been reduced to 128. And now further, if I go to the next convolutional layer, the size is increased to 128 into 64. And if I go again to this to the max pooling layer, it is 64 by 64 into 64, right? So that's why, that is how your size is reducing now. But after this, you see upsampling U4. Can you see this U4? This is the U4. This is the U4. Now here I'm starting the upsampling, and this is my skip connection. So skip connection is this one. Now here, from the features extracted here in this convolutional layer will come as a reference to the skip connection. So based on this information, now I will take the features from this my upsample data to this convolutional layer. So these are the skip connections everywhere. From the contracting path, there is a one skip connection going to the expanding path, to the skip connection. So this is how now the size will be increasing here as I'm doing upsampling after every my convolution, and finally you will see the size of this input and the size of my this convoluted output will be same one, 256 cross 256 cross 1. So what I'm saying here, you are going to generate the similar figure that is given in the input as a in the output of the unit structure. That is what is expected. That is what is expected, right? And this is what is the detailed block, detailed architecture of the convolution block. This is the detailed architecture of the center block. These are the different abbreviation: upsampling, skip connection, max pooling, expansion path. Everything is given here. Now this is the another unit that is very widely used, that is a residual unit that we have used. And here also you will see it is very similar structure is here. The only change is that you are having the residual here. This is the residual block. In this my convolutional block, I am giving the residual here. Means after the convolution of this 2D, I'll be taking these features here, and these features will also flow through this path, and the features from my earlier path will be, this residues will be added to my current features, and after that it will be going as an activation to the going to the activation function. So that is the difference. Residual in the sense the old features will also be taken as an input. Okay, आपने old features लिए, old features आगे के पाथ में गए और वो मॉडिफाई हुए, मॉडिफाई होने के बाद पुराने फीचर्स को भी आपने ऐड किया. दैट इज द रेसिडुअल्स दैट यू हैव टेकन. ओके, दैट इज व्हाट एक्जेक्टली इज बीइंग डन इन द रेसिडुअल यूनिट. This is the attention unit. Now this is the attention unit that I was telling you, that is, and if you'll see, this is having an additional block of attention block. Now what exactly is involved into this attention block? This is what exactly is the attention block architecture. This D, it is having convolutional, batch normalization, convolution, and I'm doing the addition here. Okay, I'm doing the addition operation, means those features will be added up, their size will be reduced, and then it will be activation function. And after the activation function, whatever the output will come, that will be again given to the next convolutional layer, then again batch normalization, then I'll be. So here what I'm doing, I'm using the add function, right? Here this is for the linear, and here I'm using activation function as a sigmoid. This is doing the non-linearity transformation. So one I'm doing here linear transformation, I'm doing non-linear transformation in the attention block, and that is how I'm making my system to focus more on the target. Okay, so that is what exactly is the idea. Yes, there is a transfer learning concept is there. Transfer learning in the sense, what does it means? It means that one network which is already trained, its training will be transferred to another network which is not trained at all, which is a fresh network which requires a training. Okay, so instead of training that network, what I'm doing, I'm borrowing the training from another network and giving to this network, and then thereafter I will be directly doing the testing work. I'm not doing any training of that work, of that network. That is what is called as the transfer learning. Okay, I'm transferring the learning from one network to the another network. This is only possible when you are having the similar architecture of the network, right? That is also very important. Yes, you can do some places. Even if you see people nowadays, what they are doing, लर्निंग ऑफ वन कन्वोल्यूशनल लेयर्स के वेट्स जो आपके अपडेट हो चुके हैं आफ्टर डूइंग द ट्रेनिंग फॉर वन पर्टिकुलर डेटा, तो वो कन्वोल्यूशनल लेयर्स के फिल्टर्स के जो वेट्स हैं वो आपने किसी एक आपके एक नेटवर्क के एक कन्वोल्यूशनल लेयर्स के फिल्टर्स में लगा दिए, just to understand that ki say ki yes, see this network is trained for the cats के लिए, सारे दुनिया के सारे जितने cats के images हैं उसके लिए ये network आपका ट्रेन हो चुका है. तो what I'm doing, now I want to train this network for say similar animal which looks like the cat. So what I can do something, one experiment, that I can take the final convolutional layer का जो earlier network का जो लर्निंग है उसको मैं ट्रांसफर करके अपने एक नेटवर्क में ले आता हूँ. दैट आई कैन डन, एंड फ्रॉम देयर आई कैन स्टार्ट लर्निंग माय algorithm for the another animals. So that can also be done. Okay, so partial transfer learning, full transfer learning, or that is, both the things are possible nowadays. Okay, but that requires a lot of expertise to understand how to apply that transfer learning. So that is very important. Yes, but the transfer learning gives you an advantage that it is reduces the problem of computational complexity. It gives you the better performances. It reduces the problem of overfitting. Okay, it is fast and robust. Sometime आप ट्रांसफर लर्निंग कहीं से बोरो कर ले, लर्निंग को कहीं से बोरो कर लेते हैं, आपको खाली टेस्टिंग करना पड़ता है, तो आपका ट्रेनिंग का टाइम जो है वो बच गया है. ओके, सो देयर कैन बी जीरो फुल्ली अडेप्टेड ट्रेनिंग भी हो सकती है, पार्शियली अडेप्टेड भी हो सकती है, जीरो अडेप्टेड इन द सेंस नो ट्रांसफर लर्निंग, राइट? So we also have performed this experiment of the transfer learning here as well. What we have done, we have trained our one network for the abdominal lymph nodes, we have run our one network for the mediastinal lymph nodes and we have transferred here. तो mediastinal का learning हमने abdominal में दिया, abdominal का learning हमने mediastinal में लिया. इस तरह से हमने ट्रेनिंग को ट्रांसफर किया है एक दूसरे को. So and we try to find out whether it is impacting the performance of our detection or not. Okay, so that is what exactly we have done in our experimentation. Before doing the giving the raw images into the our deep learning architecture, we have performed the task of the city windowing. City windowing in the sense, I just want to after segmentation of after automatic segmentation, I have to perform the city windowing. So that city windowing we have done. We also have done the task of data augmentation here. Data augmentation is something, जैसे मैंने कहा कि आपके इमेजेस को अगर सॉरी आपके डीप लर्निंग आर्किटेक्चर्स को ह्यूज डेटा चाहिए, अगर आपके पास लिमिटेड डेटा सेट है, then in that case what you can do, you can increase the size of your data set by creating the replicas of your existing data set. आप अपने existing images को जो है आप उससे कुछ fake images create कर सकते हैं. ओके, आप उसकी कुछ डुप्लीकेट इमेजेस क्रिएट कर सकते हैं, कुछ उसमें चेंजेस मॉडिफिकेशन करके आप उसकी कुछ और इमेजेस क्रिएट कर सकते हैं, एंड दैट इज व्हाट इज कॉल्ड एज डाटा ऑगमेंटेशन. तो इससे क्या हो जाएगा कि आपके इमेज आपका इमेज का डेटा साइज जो है वो बढ़ भी जाएगा और आपके एक सिंगल इमेज का डिफरेंट वेराइटी ऑफ द अपीयरेंस, एक इमेज का डिफरेंट जो उसके पॉसिबल और वेरिएशन हो सकते हैं, उससे भी आप उसको आपके नेटवर्क को लर्निंग मिल जाएगी. सो योर लर्निंग विल आल्सो इम्प्रोवाइज इफ यू विद द डाटा ऑगमेंटेशन. ओके, as well as the variety of the data or the variation in your data can also be learned from the data augmented images, right? So this is what exactly is here. So here in this our experimentation, as I told you that 595 388 abdominal and mediastinal lymph nodes from the 86 and 90 patients were there, but by using this data augmentation we have increased from 595 to 5595 and 388 to 5388. That is how we have increased it by using the data augmentation. Now what data augmentation methods that we used? We have used the data augmentation methods like yes, just let me show you here. Yeah, it is mentioned somewhere. I think in my next slides are there. Okay, so we have applied this data augmentation. Exactly what methods are there that I will show you in the diagram. Okay, it is flip, rotation, rotating by some angle, then flipping the images and everything. So these are the basic data augmentation methods are there. We used rectified linear unit, we use Glarout uniform for the kernel initializer, we have used class weights for handling the class imbalance problem. Then we also have done the 5-fold cross validation for the evaluation of for the performance evaluation, right? So this is the loss function that we have used for our this experimentation. So what are the results of this segmentation methods that we automatic segmentation that we performed using this attention unit and the residual unit? So जो भी आपकी performance आई है segmentation की, that we have measured by using this sensitivity, die-score and the Hausdorff distance, HT distance that we call. It is nothing but in the images for every pixel, what is the distance has been changed, that has been calculated. Okay, so by taking those three important performance parameters, we have compared our performance of the different unit structure. Then there is a segment also, then there is a residual unit is there, then there is a attention unit is also there. This is for the abdominal lymph nodes and this is for the mediastinal lymph nodes. Now with this study you can see that attention unit is performing better than all the other networks that we have taken into consideration for this our study. See, directly giving one network and saying that it is doing best is not considerable in the research. You have to compare it with the best possible existing methods. Okay, best existing methods, and that is what exactly we have done here for our proposed work. As I told you that we have done the transfer learning, so we have done the transfer learning. Yeah, Swati has asked me one question. Yes, Swati, which database is used for this work? As I told you that we have used one public available data set that is called as, I will show you the name of the database, and the link is also given here. If you, I will pass on this presentation to Dr. Ram, you people can see this. Yeah, you can see here, this is the link of that image source. Okay, this is a publicly available data set of city images in where these lymph nodes are available, abdominal and mediastinal lymph nodes are considered. This was the initial study of our work, so that's why we have taken the public data set. But when we have developed this attention mechanism, then we have created our own data set as well. Okay, and I will tell you, talk to you about that, about that as well. Okay, so let me just quickly go through this work. That, as I told you, that we have also have done the transfer learning. So we have transferred the learning from abdominal to the mediastinal. Yeah, there is another query. Can I answer the queries at the end? Okay, please allow me. So the transfer learning will be there from abdominal to the mediastinal lymph nodes. So you can see here, this is where we have again did the measurement of this learning. So what this MFTR ANH is means, for this abdominal lymph nodes, I have done the zero adaptation. Means I have not done any, I have not transferred any learning. Okay, so in that case, the performance, sorry, when I'm not having any transfer learning, only if I'm training, if I'm making my network learn from the abdominal lymph nodes, and if I'm testing it again abdominal lymph nodes only, I'm getting this much accuracy, right? But if I'm doing partially, where partially the learning from the mediastinal lymph node network is transferred to the abdominal lymph node network, and if I'm using there that partial transfer learning and trying to get the results, my results were poor compared to the complete learning from the abdominal lymph nodes, but it is considerably high, right? And if I'm doing the training for learning from the mediastinal lymph nodes, and if I'm testing it for the abdominal lymph nodes, my performance is coming low, very low. So what it is indicating, that I cannot detect the abdominal lymph nodes fully based on the learning of from the mediastinal lymph nodes. That is not correct. Okay, it is indicating that the lymph nodes located in the mediastinal locations, they are having different features, they are having different shapes. Yes, they are similar in some sense. So, and because of that because of that partial similarity, you can do the partial transfer learning, but you should not do the complete transfer of that learning of the mediastinal to the abdominal. Okay, in the similar thing that we also have observed in the abdominal lymph node detection, where you can see, happening to my cursor. Yes, this is where I am doing the mediastinal lymph node testing against the media lymph node training. This is about the partial, when my network is partially trained with the abdominal lymph node and tested with the mediastinal lymph nodes. I'm getting this accuracies, this sensitivity, die score, and Hansdorff distance. When I'm doing it only trained with the training with the abdominal lymph nodes and testing for with the mediastinal lymph nodes, in that case I'm getting very poor results. Okay, so partially the similarity is there between the abdominal and the mediastinal lymph nodes, but there is not a full similarities there. So it is indicating that yes, partial transfer learning is good enough. Okay, it is also good enough to have the detection of the lymph nodes in the CT images. Okay, so that is what exactly is here. These are some of the sample results. This is the abdominal lymph nodes. These are abdominal CTs, and you can see these are the detected abdominal lymph nodes by using that attention unit. And you can see here, so this is the die score that has been given here for every image. These are the mask of those detected lymph nodes. So these masks are the original masks, and then we have done some processing, and now they are very clear. Okay. So this is about the abdominal mediastinal lymph node results are there. You can see these are the detected. You can see this is are the detected. You can see there are two lines are here, two circles are here. One is the green and one is the red. What we have done, given it to the experts, medical experts, and we asked them to trace it manually. And our that automated tracing or automated segmentation is the green one. So we are seeing that our green is matching with the red or not, to the ground truth or not, and on the basis of that only HD is being calculated, right? Or your other performance parameters are being calculated. Okay, we also have compared for the parameters. Whenever you use a network, the computational complexity increases when you are increasing the number of layers, number of neurons, number of number of computations. तो जितने आप layers include करेंगे, neurons include करेंगे, filters का size change होगा, all that thing is going to change your training parameters. So we compared it. तो सेगनेट के लिए जैसे हमने देखा कि टोटल पैरामीटर्स हमको इतने लगते थे, यूनिट के लिए इतना लगता है, इतना हमारा रेस्टनेट के लिए लगता है, अटेंशन यूनिट के लिए इतने पैरामीटर्स लगते हैं. ओके, so what is indicating that even though attention unit comparably is requiring the highest trainable number of parameters, but compared to unit and rest unit, उसका जो भी पैरामीटर्स का इंक्रीज है, that is very negligent or very small. But with that small increase in the number of trainable parameters, we are getting a significant increase in the performance. So in that case, we can accept it, right? Yes, in the transfer learning also we have checked about the computational complexity. See, every time whenever you come out with one method having the better performance, you should not declare it as the best thing. See, if it is taking a lot of time, it is taking a lot of computational power, then those methods are not able to adapt as for the real time application. आपकी उसकी computational complexity भी कम होनी चाहिए. So you have to work in all those direction. आपको ये भी देखना है कि performance भी अच्छी हो, computational complexity भी कम हो, computational time भी कम हो जाए, trainable parameters भी कम हो जाए. ये सब कुछ आपको देखना होता है when you want your system to go as for the real time application, right? So we also have again checked here for the attention parameters here for the transfer learning. So full adaptation, partial adaptation, and zero adaptation, the trainable parameters are almost equal. Okay, but the thing is that yes, if I'm doing zero adaptation also, I'm having the very good performance. At the same time, if I'm doing the partial adaptation, my performance is again good enough. If it is 90% with the zero adaptation, it is coming 85%. So that is good. Okay, so conclusion is that yes, lymph node detection is successful with the attention unit. Attention unit is having the best results. Yes, you can increase the data size by using the different data augmentation techniques. So with the data augmentation techniques, your performance is increasing, your learning is increasing, right? And transfer learning also is useful if it is partially, right? So with that conclusions, I completed my task of the segmentation. Then there is a task of the classification. All those segmented lymph nodes now I am giving to my another deep learning architecture, which is actually we designed for the classification, right? So, and what that classification architecture is doing, it will be classifying those lymph nodes into the categories of the malignant and the benign. It is finding out whether it is disease or non-disease, whether it is cancerous or not cancerous. Okay, so that is what exactly we are trying to do into this class of classification. I will quickly go through this because as I'm running out of time, but I just wanted to tell you about these things. So these are some of the lymph nodes that malignant lymph nodes and benign lymph nodes. If you just have a look visually, अगर आप लोग देखेंगे आपको कुछ you will not understand which one is the malignant and which. But when your computer will read it or learn it with the pixel values, it will be able to understand whether it is malignant and benign. So that's why I'm telling that medical radiologists, if they are very expert, then only they by just looking at it, they make suspiciously say that yes, this is suspicious, and they may ask you to go for biopsy. They will not say that yes, you have a cancer at this lymph node and we need to go for the surgery. It's not like that. Okay. Yes. So what I'm telling here that existing CNR architectures are having again those problem of the overfitting and everything that has been described here. So what we have done in this convolution, in this particular classification, we have used fully convolutional network here. Fully convolutional network. Why we have used fully convolutional network? Let me just tell you about this fully convolutional network, because we wanted to have low overfitting, okay, and we wanted to have, when it is fully convolutional, in the sense you will be having the multiple convolutional layers, it will be able to extract more and more data from the from your features. तो आपके पहले कन्वोल्यूशन के बाद जो फीचर मैप बना उसके फर्दर फिर से कन्वोल्यूशन आएगा, that will be further extracting the features from that feature map. So that is what exactly will happen. You just see the difference between the traditional CNN and the FCN network. Just I will not go to the text, I will show you with the diagram. Okay, तो आपका एक बेसिक CNN स्ट्रक्चर जो होता है वो क्या करता है, आपने इमेजेस लिए, उसमें आपने डाटा डॉक्यूमेंटेशन लगाया, and then you have done the feature extraction using convolutional layer and subsampling layers, right? And what will happen in the convolutional layer, it will go to the fully connected layer. आपने कन्वोल्यूशन लेयर्स लगाने के बाद क्या होगा, आपका जो भी आउटपुट आएगा एक्टिवेशन फंक्शन से, दैट विल गो टू द फुल्ली कनेक्टेड लेयर व्हिच इज नथिंग बट द क्लासिफिकेशन लेयर. Okay, so that will be creating more trainable parameters and it will be creating more problem of the overfitting. While in case of fully convolutional network, what will happen, it will also be similar up to this point, but after next to this, classification will be done by using convolutional layer. It will not be done by using the fully connected layer. fully connected layer, let me tell you about this. Fully connected in the layer, अगर आपको न्यूरल नेटवर्क याद हो, दो लेयर्स के बीच में हर न्यूरॉन के साथ कनेक्टेड होता था, that is what we call as a fully connected layer. While in case of fully convolutional network, जो क्लासिफिकेशन लेयर होती है सबसे आखिरी वाली, that will also be a convolutional layer where the data from the earlier layer will come and it will be convolved with the filters present in that convolutional layer, and the output will be of a reduced size. And what will be the size of that output, it will be as per the classes required from this experimentation. हमें कितने classes चाहिए, 2, so the output will be 2 in the case of fully convolutional network. So this is what exactly the architecture. Now just have a look at this. This is one convolutional layer, then there is a max pooling layer, then there is a convolutional layer again, max pooling layer here, then again convolution, then again convolutional layer, another convolutional layer, right? Then after that, this is complete my convolutional network. Okay, and now it is going to the output layer. This output layer is again having the convolutional layer of size 2 cross 1 cross 1, only 2 output. It will be giving you the only 2 output, and that will go to the global average pooling here. Okay, and then there is a softmax layer which will be giving you the 2 outputs here. One, either you will be having the highest value for the malignancy output or for the benign output. तो अगर आपके इस आउटपुट की वैल्यू, ज्यादा है आप बोलेंगे बिनाइन है, अगर आपके इस आउटपुट की वैल्यू ज्यादा है तो आप बोलेंगे मैलिग्नेंट है, राइट? सो दिस इज हाउ इट एग्जैक्टली इट वर्क्स. So this is the fully convolutional network. We have used 271 images of 138 benign, 133 malignant. Now this is the data that we have actually collected at the hospital. Okay, in a local Raipur hospital where we have collected. We have one cancer center here in the government medical hospital. There we have collected this data set. We have used the data augmentation again, as I told you. These are the data augmentation techniques that we have used. We have flipped the images. We have rotated our images. We have inputted our noises in our images. We have made those images sharp. We have blurred those images, and that is how we have increased our size of the data. Okay, so we have increased it from 271 images to 4065 images of the benign and 195, sorry, 2070 of benign and 1995 of the malignant city images. So we have created almost, you see, total 4065, and here it is total 271, almost 20 times higher images that we have created. So this is the fully convolutional network architecture. This is the architecture, and this is the results. Actually, we have calculated here the accuracy, sensitivity, specificity, area under curve. These are the performance parameters for any classification process that all you know about this. So we have compared it with the fully connected layer based model also, and this is our proposed fully convolutional network model also. And you can see there is a difference between the performance of almost 10 to 20%. Okay, we'll see the sensitivity, it is 10% higher. If we'll see the specificity, it is almost 20% higher. Area under curve has been improved by 10%. And if you just see the total trainable parameters, that has also reduced in the fully convolutional network as compared to the fully connected layer. I will tell you one thing. If you people understanding fully connected layer, every neuron is going to be connected to every neuron. It is very much clear that uh, the number of trainable parameters are going to be higher in the case of when it is fully connected layers, right? Okay. So this is the data that we have created by using the augmentation. You can see these are our total original images. We have added this noise. तो ये नॉइज ऐड किया है, शार्पनेस ऐड किया है, रोटेशन हमने ऐड किया है 27 डिग्री से लेके -270 डिग्री तक. फ्लिप हमने हॉरिजॉन्टल भी फ्लिप किया है, वर्टिकली भी फ्लिप किया है. ओके, हमने नॉइज ऐड किया है, गॉसियन ब्लर ऐड किया है, वेयर द सिग्मा इज हैविंग द वैल्यू ऑफ 2, सिग्मा इज हैविंग द वैल्यू ऑफ 4. देन हमने इनका और इनका कॉम्बिनेशन किया, फिर उसमें भी हमने ऐड किया. सो विल सी इट इज अ ह्यूज एक्सपेरिमेंटेशन ऑफ द डाटा ऑगमेंटेशन दैट वी हैव कंडक्टेड हियर. ओके, तो हमने मतलब क्या किया कि इन दो इमेजेस को ऐड करके फिर इनके ऊपर हमने दूसरा डाटा ऑगमेंटेशन टेक्निक लगा दिया. ओके, सो दैट इज हाउ वी हैव क्रिएटेड ऑलमोस्ट. तो वी ऑल्सो हैव सीन कि अगर हम ये डाटा ऑगमेंटेशन नहीं लगाते तो क्या हमारा ये नेटवर्क यही रिजल्ट देता. वी हैव सीन दैट परफॉर्मेंस हियर. You see that performance. With that only 271 images, we were getting the accuracy of 61%. We were getting the sensitivity of 58%. We were getting the specificity of 67%. It was poor. Same network. Nothing has been changed. Only by just increasing this data size, we are able to gain this performance on the same network. On the same network. What does it indicate? It is indicating that data augmentation gives better learning to the network. First thing. And increasing the data size increases the learning of your network. So this is very important. This is very important outcome that you have to understand. And we have not done it directly from 271 to 4065. We have done it gradually. You see this experimentation. We have tried it with the 1897 images, which are data augmented, but some limited techniques were applied. We have got the improved performance compared to this one. यहाँ से हमारी परफॉर्मेंस कंपेयरली इंप्रूव हो गई. फिर हमने 2168 में गए, फिर से इंप्रूव हो गई. फिर हम जब 2431 में गए तब भी हमारी इंप्रूव हुई. देन वी हैव मूव टू 2710, वी इंप्रूव्ड अगेन. एंड व्हेन वी हैव कम टू हियर, then we have got the best performance. See, this is how you have to develop your system. This is how you have to do your research. Okay, try to see that every one single percentage in performance improvement, 2%, 3%, you evolve it, right? So this is what exactly we have done. We have we also have done the experimentation by changing the different blocks in our fully convolutional network. तो उसमें हमने जो जो parameters use किए, convolution जो filter use किया, उसके size को हमने change करके दिखा है. That size we have changed from 1:1 to 2:2. We also have changed the activation function. लीकी रेलू हमने यूज किया रेलू की जगह पर. हमने जो मैक्स पुलिंग हमने यूज की थी, तो उसमें हमने ग्लोबल एवरेज पुलिंग यूज करके देखी. हमने ऑप्टिमाइजर भी चेंज करके देखा, एडएमएक्स की जगह आरएमएस प्रॉप करके देखा. Then we also have done all these things, experimented, and we have checked the performance of our network. Ultimately, I want to tell you that it is the fully convolutional network is having the best result, and with this performance parameters, you can see the convolutional layer having the size of this. Okay, so if I'm changing my accuracy, this is the proposed model where I was using the global average, जो भी मैंने parameters use किए थे, and you will see the performance parameters is changing. Okay, so this is all can be observed from this diagram. Okay, finally I would like to tell you that the proposed model is able to attain this much sensitivity, specificity, accuracy, and area under curve. We also compared it with the state of the art other mechanisms like VGGNet, LeanNet, then fully connected layer based model that I already shown you. And compared to that, all this proposed model of fully convolutional network is having the highest performance. So conclusion is that yes, fully convolutional based deep learning network architecture performs well for the classification of the lymph nodes. Okay, and second thing is that it is able to have the able to handle the problem of overfitting, giving the higher performance. It is also having the reducing the trade-off between the sensitivity and the specificity. Yes, smaller data size के साथ हम लोग काम कर सकते हैं, as you can have that data augmentation. Selection of the data augmentation methods is also very important, as I already shown you with that our experiment. And optimized selection of the parameters is also important, and their tuning and is required for getting the reliable systems. That is very important. Reliability of the system is very important. Sometimes what happens that अगर आप लोग कुछ change करते हैं अपने network में, then you suddenly get some bad results. So that is not good. That is not the reliability of the system. The system must be reliable, and it should be tested and experimented with all the possible combinations so that it can be considered or it can be declared as a reliable system, right? So thank you so much everyone for attending, for patiently listening to me. Now let me just quickly go to the chat box to see the queries raised. Yes, yeah. Swati has asked me something. Then Abhaya Kumar, how add and multiply operations are performed in attention unit? Okay, it is a matrix operations that you have to perform first. Okay, uh, you just take your matrix and say that you want to uh, if you have some say that matrix size of 5 cross 5 and you want to perform the addition, you will be just adding those values and finding out one single value. Or you can add some block and then you can take some part of from that matrix, add those blocks and take that value, replace that value with those blocks. Okay, with the addition of those blocks, right? Please ask the query after. Okay, how to trace the portion automatically? This I do not understand. Jaspin, can you please clarify your this question to me? Jaspin, are you here? Hello. Yeah,
1 minute.
Jaspin.
Just हाँ Sanjay Kumar Singh sir has a doubt.
Yeah, sorry. Whatever it is. What is the question? This how to trace the portion automatically? What does it mean? Segmentation. Are you talking about segmentation? Hello. I do not actually understand the question. Please, if you can ask me again, that will be really nice. What I'm understanding here, you are asking about how to do it automatically. See, there is no automatic computer program will read your image in a matrix form. Okay, matrix will be having some numerical values, pixel values. So those pixels values will go to your network. Okay, so when it is flowing, when it is going through the network, it will be going from one stage to another stage. So while going from one stage to another stage, your those matrix values are going to change, and even the size of that matrix is going to change. So that will flow through that matrix, and finally, what is happening? It will be generating as a hello. See, I'm not having a clear. Yes. Was I mute? Okay, what I'm saying. Yes, what I'm saying.
Hello.
Hello.
Hello, sir. Hello. Am I
Yes.
audible, sir?
Yes. Yes.
Sir, actually, you have told me how to perform add and multiply operation in attention unit. So here actually addition part, when we are going to add something, that means previous that input and along with this after convolution, that part.
No. After the convolution, whatever the whatever the input coming to that add block need to be added. Okay. So
So
one thing
kindly
is,
go to that slide, sir, so that I can understand, sir.
let me just tell you.
Yes, sir.
Yes. I'm going back to that.
Yes, sir.
Here only you're
Yes,
talking.
here,
Is
sir.
na? Yes.
Yes, sir.
Now
Yes, sir.
you just look at here. You just look at here now. Come here. You see this skip connection is here to this attention block, right?
Yes, sir.
So what will happen? You will be taking these features. Okay, these features will be taken up, and it will go through this convolution block, batch normalization, convolution, batch normalization, right? And the output here will be added with the with this input here, right?
Yes, added with that, sir,
Yeah.
convolution block that part.
Yes.
Okay, sir. Similarly,
The
same also for multiplication, sir.
no, where here for the multiplication here.
Yes, sir. That part.
Here. Yes.
Yes.
Here also.
Okay, sir.
I got it.
Okay, sir. Okay, sir.
Now I
Thank you,
got
sir.
your question. See,
Thank you, sir.
and most important thing is that here, it's okay when you are doing this addition. First thing is that you have to do the linear transformation, and second, you have to follow it by the non-linear transformation.
Sir, here
That
always we are using sigmoid as nonlinear or any other nonlinear function that is.
any other non-linear you can try. See, we have decided on the basis of our experimentations. It's not very easy
Hit
to.
and trial method, sir, actually.
Yeah.
And another one question in the output layer, why you are always taking as softmax function as the output layer function?
Softmax, why we are
Yes.
taking?
Yes, sir.
See,
In all
what
every
happens
cases already I have seen, sir. In optimization case or in normal deep learning neural network, I have seen also.
everywhere softmax is used for the when we are doing the final classification stage is there now. What happened that whatever the output that comes from the neural network, so that will be a matrix, huge matrix. Say that before softmax layer there is a convolutional layer, like in FCN. I just now
Yes, sir.
described
Yes,
you
sir.
FCN.
Yes, sir.
So there will be a fully convolutional network. So that will be a huge matrix. And instead of handling that all the values of the matrix, why not to calculate the probability, some simple probability, two simple values of the probability by using the softmax. What is softmax is involved? Softmax is nothing but one probability function, best function. What it
Yes.
does, it takes all the values and give you one probability value, two probability values. So it will be giving the probability that either it will be this one based on all the values given to me. Okay.
Yes, sir.
So it will be giving two probability values. So one probability value will be maybe higher for the say for malignant, and maybe it will be lower for the benign. So that is how it is used. Okay.
Yes, sir. Got it. Sir. Thank you, sir.
Okay. Thank you. And then there is portion any manually trace the portion manually any tools. Yeah. Uh, See, this is very nice question, because everybody feels that how those radiologists are going to do it manually. See, if you'll go to the radiologist, Philips, or all the imaging companies, the equipments that are provided by those imaging companies, they give their softwares, and radiologists are able to trace anything on that. तो manual tracing वो लोग कर सकते हैं उसके ऊपर. तो वहां से अगर आप उनकी ट्रेस्ड इमेजेस को अगर आप कैप्चर करते हैं एंड यू कन्वर्ट इट इनटू जेपीजी, यू कैन यूज इट एज अ ग्राउंड ट्रूथ. फर्स्ट थिंग, या तो आप वहां से ले सकते हैं. सेकंड थिंग, if your medical expert is not available to you, then what you can do, you can learn 2 or 3 images on your own, and you can have your own image tracing software. So likewise, we have one image tracing software which is uh, which we have built with the global information technologies USA. तो उनका हमने एक इमेज ट्रेसिंग सॉफ्टवेयर हमने रेडी किया था, वहां से हम उसको यूज करते थे. बट इट इज मोस्टली फॉर द सर्कुलर शेप्स. Where the shapes are not circular, then we have to it's better to you get it from the radiologist. That is one thing. Yes, regarding softmax, I think I am clear now. Tools, please tell which tools that we have used. We regarding developing the deep learning architecture, we have used uh, Python, Keras platform that we have used. All the inbuilt tools, libraries have been used in the Keras. And how to create database from the cases collected from the hospitals, how many images per series per patients working on CT images for cancer diagnosis are need to be. This is a very important question. See, collecting the own data set or self creation of the data set is very difficult. First process is that you have to have the ethical committee clearances from both the places. पहला वो जहां पे आप डेटा कलेक्ट करना चाहते हैं, सेकंड प्लेस वो जहां पे आप उस डेटा के ऊपर रिसर्च करना चाहते हैं, मतलब आपका इंस्टीट्यूशन, होस्ट इंस्टीट्यूशन एंड द अदर ऑर्गेनाइजेशन वेयर यू वांट टू कलेक्ट द डेटा सेट, हॉस्पिटल जो भी है, वहां पे इथिकल क्लियरेंस कमिटीज होती है. तो आप अपना प्रपोजल उनको दीजिए कि मुझे इस टाइप का एक वर्क करना है जिसके लिए मुझे ये डेटा चाहिए. अगर वो आपका प्रॉब्लम चैलेंजिंग फाइंड आउट करते हैं, अगर उनको लगता है कि यस दिस इज अ सब्सटेंशियल रिसर्च वर्क इज देयर इन दिस चैलेंज, दे विल अप्रूव योर वर्क. And after the ethical clearance committee clearances, they will allow you to collect the data at their hospital. Now once you collect the data with the hospital, now you also have to give the ethical committee कि आप inform जो patient है उसको एक inform उससे एक सिग्नेचर्ड डॉक्यूमेंट कलेक्ट करेंगे, कंसेंट फॉर्म पे साइन करवाएंगे. ऑल दैट यू हैव टू डू. एंड इट इज वेरी डिफिकल्ट एट सम टाइम्स, बिकॉज क्या होता है कि जैसे मान लीजिए आप लंग कैंसर पे काम कर रहे हैं, लंग कैंसर का पेशेंट जब वहां आएगा तब आपको वहां जाना है, यू हैव टू सिट विद द रेडियोलॉजिस्ट, यू हैव टू गेट द डेटा. वो डेटा सिर्फ कलेक्ट करना इज नॉट इनफ, उसको ग्राउंड ट्रूथ भी उन्हीं से रेडी करवाना होता है. सो इट टेक्स लॉट ऑफ टाइम, ईयर्स ऑफ टाइम. ओके, so most of the research in such kind of cases, most of the research time in such kind of cases goes into collection of the data set. So if you want to really work on the self-created data set, it is a very good thing to work on the self-created data set, but you have to spend a lot of time on doing that thing, right? Very informative class. Thank you. Thank you. Very where we will collect the medical databases, I have told you. Just no provision to unmute. Yes sir. How can we start an mammogram images? Just now I told you, you prepare your proposal, give it to the hospital ethical committee. Hospital will clear that. Once they find it very interesting, they will allow you to take the images of the mammogram images at the hospital. Then you can create. All the government hospitals are having those facilities. Ethical clearance committees are there. You have to go there, right? And why they are having those ethical clearance committees? Because in their hospitals also there are PG programs, UG program, medical UG and PG programs radiology programs are happening, and they used to collect the data sets. तो उनके पास ऑलरेडी वो प्रोग्राम्स रन होते हैं, उनके वो इथिकल कमिटीज हैं ऑलरेडी. अगर आप बाहर से जाते हैं तो यू आर नॉट गोइंग टू ट्रबल देम मच. ओके, we start on mammogram images. You can start on the mammogram images. If you need any help, you can just contact me. How to collect medical images, as I told you already. Please share with us. So I have already told about this very information. Thank you. Thank you. Okay. Yeah. Okay. Thank you. Thank you so much, all the participants. Dr. Ram Kumar, I hope I leave it to your expectations and the time that has been given to me. So thank you so much once again, Mr. Rashid, Mr. Ram.
Thank you, sir. Session was very energetic and informative. Okay. Once again, I would like to thank Dr. Narendra D, Londhe, sir, for delivering and enlightening with us their knowledge. Session was full of knowledge and interesting facts, especially the points where Dr. Narendra sir told us about the computer-aided diagnosis, classification in CT image using deep learning, CNN, CT windows and data augmentation was really informative. I'm pretty sure the precious knowledge that Dr. Narendra sir gave us will definitely help in our research and future. Thank you, sir.
Thank you. Thank you so much, Dr. Rashid, Dr. Ram Kumar, for inviting me. And this is just one study, one data set that we have used. Likewise, I have done work on EEG, then psoriasis, then there are So sometime in future, whenever I will get a chance, then again I will discuss about it. So thank you once again, all the participants, for patiently hearing my session. And if you have any queries, my email ID, my details are with the organizers. You can get in touch with me, and I will surely like to help everyone, those who want to start their research in this area. So thank you once again. And with the permission of the organizers, now I would like to take their leave.
Thank you, sir.
Thank you.
Thank you.
Okay. Thank you. Thank you so much. Thank you.
So thank you all the participants. So it's time to lunch break. So we will start the next session from 3:10 p.m. Thank you.